Hello everyone, this is Dr. Abhinav, and recently we are seeing a huge number of COVID cases, but most of the cases we believe to be Omicron cases, and it is a good thing that most of the cases are mild and asymptomatic. So recently, I've been seeing many patients who do not have much of a symptom, but turn out to be RT-PCR positive, or who patients who have mild symptoms and again RT-PCR positive. So most of the patients do not want to get admitted and they want to isolate themselves at home itself. So the recently government of India has released guidelines for home isolation for patients who are mild and asymptomatic COVID-19 cases. So in this video, I'll be telling you about how to get yourself isolated and what are the things that you need to monitor regularly and what are the things need to be done and what are the things that should not be done and when should you stop your isolation. All those things we'll be covering in this video, so stay tuned and watch till the end. So this guidelines was given by government of India, coming under the uh, Ministry of Health and Family Welfare. So this was given on 5th January 2022, just quite a few days ago. So we'll be basically seeing about the guidelines in this video. So the revised guidelines for home isolations of mild and asymptomatic COVID-19 cases. So first they have given that in the past 2 years, most of the COVID-19 cases that we have seen are either asymptomatic or will be having very mild symptoms. So most of the patients would want to be isolated at home itself. So the Ministry of Health and Family and Welfare, that is the main reason why they have given an updated guidelines for home isolation, because the variant that was previously seen and now it's quite different. So they have updated guidelines also. So this guidelines, what they are mainly focusing is that what should be done and what should not be done and the things to monitor. So in asymptomatic or mild cases of COVID-19 are cases who are laboratorily confirmed, that is RT-PCR positive, but they are not experiencing any symptoms, like, and their oxygen saturation at room air is 93%. So as we all know, oxygen saturation, we can check the pulse oximeter probe, and if it shows more than 93, then it's good according to this guidelines. Or patient can be having mild symptoms like upper respiratory tract symptoms, for example, coughing, sneezing, running nose, those kind of things, with or without fever, but mainly without shortness of breath. And they also should have oxygen saturation at room air more than 93%. So these two types of cases are termed to be asymptomatic cases or mild cases of COVID-19. And this video is mainly for patients who are in this category. Okay. So who are the patients eligible for home isolation? So the patient should be clinically assigned as mild or asymptomatic case by the treating medical officer, not by yourself. So the medical officer that you are getting treated to must say that you are either an asymptomatic case or a mild case, and you can be having your home isolation. And if only the medical officer approves, then you are eligible for home isolation. So such cases should have requisite facility at the residence for self-isolation and for quarantining the family contacts. So you should be having enough space for yourself to get self-isolated, and your family members should also have space to be in the quarantine period. Okay. So the caregiver, ideally someone who has completed his COVID-19 vaccination schedule, should be available to provide care on a 24/7 basis for you. So whenever you are doing your home isolation, the government of India recommends you to have a caregiver who has got both the doses of COVID-19, and it is necessary to have a caregiver. So a communication link between the caregiver and the medical officer is a prerequisite for the entire duration of home isolation. So even for how many days you want to get isolated at home, the caregiver should be there, and the caregiver should be constantly in contact with the medical officer who has assigned you to have your home isolation. Okay. So an important thing here: elderly patients more than age 60 and those with comorbid conditions. Comorbid conditions is like they can have other health problems like sugar, BP, heart problems, lung problems, kidney problems, and stroke patients. All those patients shall only be allowed home isolation after proper evaluation by the treating medical officer. So, if you have any one of these comorbidities and your age is more than 60, then you need to get consulted again with the medical officer, and then only if he approves, you can be having a home isolation. So patients suffering from immune compromised status, that is HIV patient, transplant recipients, cancer therapy patients, are not recommended for home isolation and shall only be allowed home isolation after proper evaluation by treating medical officer. So patients who are immune compromised, so immune compromised patients are usually in our body we have antibodies to fight infections, but in the immunocompromised status, the antibodies are very less. So even if you get any infection, your body will not fight against it. So this kind of status is usually seen in patients with HIV, transplant recipients, cancer therapy patients, and generally the government of India is not recommending for these patients to have self-isolation at home. Okay, it is better to get admitted in a hospital and treated accordingly. So while a patient is allowed home isolation, all other members in the family, include other contacts, shall follow the home quarantine guidelines. So you can check the guidelines here. So, what should be instructed to the patient? The patient must isolate himself or herself from other household members, and they should be in a separate room. And mainly, they should not come in contact with any elderly patients at your home. So, if you have any elderly person who's also having with comorbidities like BP, sugar, and all those kind of things, then it is better to not come into contact with those kind of people, and the patient should stay in a well ventilated room with cross ventilation, and windows should be kept open to allow fresh air to come in and to go. The patient should use triple layered medical mask. So he or she should be wearing this mask always, and they should discard the mask after 8 hours of use or earlier if the mask becomes wet or visibly spoiled. Okay, so maximum you can use a mask only for 8 hours. Masks should be discarded after cutting them to pieces and putting it in a paper bag for a minimum of 72 hours. So if you know this and should follow this point also. Patient must take rest and drink lots of fluids to maintain adequate hydration. So patient should also follow respiratory etiquettes at all the time. So whenever you sneeze or whenever you cough, you should close your mouth, and basically you are already wearing a mask. So proper hand wash and all those kind of things is really important. So undertake frequent hand washing with soap and water for at least 40 seconds or clean with alcohol-based sanitizer. Patients shall not share personal items including utensils with other people in the household. Sharing of items is not advisable. So we need to ensure cleaning of frequently touched surfaces in the room, for example like tabletops, doorknobs, handles with soap, detergent and water. Constantly be cleaning the places where the patient touches or comes into contact. So the cleaning can be done by patient or the caregiver. Self-monitoring of blood oxygen saturation with a pulse oximeter for the patient is very much advised. So by this time you must have already seen the pulse oximeter and you already know how to use it. So the pulse oximeter will basically show the oxygen saturation, and you can also see the pulse rate there. So you should self-monitor your blood oxygen saturation. Patient shall self-monitor his or her health with daily temperature monitoring. So this whatever you monitor, you should write it down and share it to your medical officer. So you can make a chart like this. You can write date and time, your temperature, heart rate, SpO2, that is oxygen saturation, feeling, how's the patient general condition? Is it better or worse or same? Breathing, how's the breathing pattern? Is it better or is it worse? So you all know how to use a pulse oximeter. You can you should have seen the machine. You should have your finger and Open the pulse oximeter and insert it in your finger, and then the reading will be seen. So for self-monitoring blood oxygen saturation with a pulse oximeter, place the index finger after cleaning hands and removing nail polish, if any, in the pulse oximeter probe and take the highest steady reading after a few seconds. So initially it may fluctuate, but wait for some time and steady reading will be seen, and that reading will have to record. So for recording your breathing, the patient may self-monitor breathing rate or respiratory rate in a sitting position, breathe normally and count the number of breaths taken in one full month. So you can ask your caretaker to monitor your breathing, or you can monitor by yourself itself. So what are the instructions for the caregiver? So regarding the mask, so again the caregiver should wear a triple layered medical mask, N95 mask to be considered, and the front portion of the mask should not be touched or handled during use. The mask gets wet or dirty when you change it. If again you have to put in a paper bag and discard it after 72 hours, perform hand hygiene and avoid touching face, nose, or mouth. Regarding the hand hygiene, so hand hygiene is really important for the caregiver. So he or she should use soap and water for hand washing for at least 40 seconds again, or you can use alcohol-based sanitizer. Then you have to use the disposable towel after washing hands. Then before and after wearing gloves, you should perform good hand hygiene. Exposure to patients or patient environment. So the caretaker should avoid direct contact with body fluids such as the respiratory secretions, oral secretions, including saliva of the patient. Use disposable gloves while handling the patient. Avoid exposure to potentially contaminated items in his immediate environment, like avoid sharing eating utensils, dishes, drinks, used towels, or bed linen. Food must be provided in the patient to the patient in his room. Utensils and dishes used by the patient should be cleaned with soap, detergent, and water while wearing gloves. The utensils may be reused after proper cleaning. So utensils can be reused after proper cleaning. Clean hands after taking off gloves or handling used items. Use triple layer medical mask and disposable gloves while cleaning or handling surfaces. So perform hand hygiene before and after removing gloves. All these are for the caretakers. So regarding how will you dispose the things that have been used by the patient. So effective and safe disposal of general waste like disposable items should be ensured. So they should be collected in a black color bag, tied properly, and hand over to the waste collectors. But in case if there is any secretions or used masks, gloves, which you think might be contaminated, all those things you should put in a yellow bag and then hand it over to the waste collectors. So these are basically how to take care of the patient from the caregiver, and what the patient should do, and how the waste material should be disposed. Apart from this, what we'll be seeing is that uh, about the treatment for patients in mild asymptomatic disease in home isolation. The first and important rule is that you do not self-medicate yourself with anything. Whatever you want to medicate, contact your medical doctor and ask him, get his permission, so get his opinion, and then you will have to take whatever it is needed. Do not self-medicate yourself with anything. Okay. So patient must be in communication with the treating medical officer and promptly report in case of any deterioration. So if you think that you're not feeling well, if you think that your pulse oximeter's SpO2 is dropping or breathing is getting difficult, then you should immediately communicate your medical doctor. The patient must continue the medications for other comorbidities illness after consulting the treating medical officer. For example, you have been using 2 tablets for hypertension and 3 tablets for sugar, then you should show those tablets to your doctor and ask him whether if you can continue those tablets. If he says yes, then you can definitely continue those tablets. So patient may utilize the teleconsultation platform made available by the district state administration, including the e-Sanjeevani teleconsultation platform available at this website. So you can do the teleconsultation in this website also. Patients to follow symptomatic managements for fever, running nose, cough as warranted. So patient may perform warm water gargles or take steam inhalation 3 times a day. Fever is not controlled, then the maximum dose of paracetamol 4 times a day, then you should consult your doctor. So information floating through social media mentioning non-authentic and non-evidence-based treatment protocols can harm patients. So misinformation leading to creation of panic and in turn undertaking tests and treatment which are not required has to be avoided. Clinical management protocol for asymptomatic mild patients is available at the website of Ministry and Family Health. So you should refer those things with the medical officer. So you may be receiving many treatment guidelines or non-authentic treatments in the WhatsApp or any other social media. So don't go with it. Whatever you want to do, you just have your opinion with your doctor, and then you can do. So don't see those WhatsApp messages and start using those things because you might be already getting treated by a medical doctor, and those other things which are non-authentic can have some other mixed products in it. The chemicals and molecules can be different, and combining both the things or taking alone those things can cause interactions in your body, and you can have other problems also. Make sure that whatever you want to take anything apart, so contact with your medical officer. Do not rush for self-medication, blood investigation, or radiologic images like chest X-ray or CT scans without consultation of your treating medical officer. So nowadays we are seeing patients who are having running nose cough, and they come to us with the report of CT test. So they think that taking CT test is easy and they directly go and take it. So that is not how it goes. You'll have to first get consulted, and we'll have to see if the CT is required or not. Only after that, getting a CT scan will be preferred. Because just taking chest CT is not a simple thing. Because when you take chest CT, you are going to be exposed to radiation. And remember, this radiation can cause some problems, but it is quite kind of mild problems, not seen in all the patients. But CT scan when you are pregnant or you'll have some other problems. There are few conditions where CT scan should be thought twice or thrice before using or contraindicated also. Make sure that you get a doctor's opinion before taking yourself any medicine or doing yourself any scans. Okay. Steroids are not indicated in mild disease and shall not be self-administered. Because steroid itself has a lot of side effects. So you should not take steroids like taking paracetamol. So steroids are completely different, and they have quite a lot of side effects. So, and the dosing of steroids, the tapering of dose, all the things are quite important when taking steroids. So it is not something to be self-medicated. So it should be taken under proper guidance. The treatment for every patient needs to be monitored individually as per the specific conditions of the patient concerned, and hence generic sharing of prescriptions shall be avoided. So you may be seeing that your neighbor was treated for COVID with a list of medications. That doesn't mean that if you take those list of medication, you'll be all right. No, each patient, the medication will be tailored, will be altered, and according to the needs, we'll be giving the medicines. So we might be prescribing steroids for some other patients because of some other cause, or if this condition is quite deteriorating. That doesn't mean that you should necessarily take steroids. You should take steroids only if it is needed for you. So whether if it is needed or not, that you can ask your doctor and get his advice also. So treatment, in case of falling oxygen saturation or shortness of breath, the person may require hospital admission and shall seek immediate consultation of their treating medical officer surveillance care. So whenever you think that you're not feeling all right, or your condition is getting deteriorated, then you'll have to contact your medical officer immediately. So when to seek medical attention? This is very important. Patient or caregiver will keep monitoring their health. Immediate medical attention must be sought if serious signs or symptoms develop. These could include unresolved high-grade fever for more than 100 Fahrenheit for more than 3 days, or difficulty in breathing, dip in oxygen saturation like SpO2 pulse oximeter, it is less than 93 on room air, or at least 3 reading within 1 hour. So within 1 hour, you do SpO2 check for 3 times, and it's less than 93, then you'll have to seek medical attention. Or if your respiratory rate is more than 24. Persistent pain or pressure in the chest, medical confusion or inability to arouse, severe fatigue or myalgia. So these are the 6 things when present you should immediately seek medical advice or medical attention, because this may be a symptom of worsening of your condition and you might need admission because of these things. So then after this, when should you stop, discontinue home isolation? So patient under home isolation will stand discharge and end isolation after at least 7 days have passed from testing positive and no fever for 3 successive days. So these things should be met, these criteria should be met, and they shall continue wearing masks. There is no need, they have made it clear, no need for retesting after the home isolation period is over. So if it is at least 7 days and you have no fever for the past 3 days, then your home isolation can end, and there is no need for retesting after home isolation period is over. Asymptomatic contacts of infected individuals need to undergo COVID test and monitor health in home quarantine. So asymptomatic contacts, so people who have come in contact with the patient, even though if they don't have any symptoms, they need to undergo a COVID test and monitor health in home quarantine. So these are the things that I wanted to tell you. Since most of the patients are preferring to get home isolation, then this video can help you, because here I have told you what should be done, what should be monitored, when to contact your doctor, and when should you seek medical attention. Those all kind of things I have told in this video. So make sure you wear your mask whenever you go out, and don't go out unnecessarily, and please stay safe, because it is true that we are seeing lots and lots of COVID cases in the past 2 days itself. So please make sure you are safe, and ask your parents also and your friends also to be safe. Always keep wearing your mask. So that's all I wanted to say for today. If you haven't subscribed to our channel, please do subscribe. That's all. Thank you.